we don't talk about it enough, but stress reduction. Like stress is huge, and a little bit of stress here and there is fine, right? That's good for you. But if you are chronically stressed and you are not allowing yourself time to relax, or you're burnt out, it's going to affect your overall health. It's going to affect your sexual health. It's going to affect your hormonal health. And, we know it's true. If you look at sort of people who are in military training, their testosterone's tanked because they're super stressed. These are guys at their peak physical fitness, right? But these guys, their testosterone is tanked because they are so overly stressed and worked so hard that it comes down. And so, not most people are not going to get to that point in terms of physical exercise to cause their testosterone to go down low. But some people, chronic stress does create a toll.
Dr. Rena Malik, welcome to Passion, Love, Pursuit podcast. I am so darn excited to have this conversation today. As I was mentioning offline, as I was prepping for this interview, I realized this is actually a topic that a lot of people experience, but they never either talk about or even go see a professional about, because it's one of those taboo topics that people are shameful about. So I know that everything you talk about is definitely the things that people want to know more about, but they're afraid to ask somebody about. So welcome to the show. Thank you so much for being here.
So much for having me. I'm excited to talk about it all.
Yeah. And like I said, we are going to go into as much as possible we can in this hour. I know there's a plethora of things you cover, but I'm going to try to break up the episode covering topics around pelvic floor, pelvic health, sexual health, and then men and women topics. But of course, I feel like women in general love hearing or learning more about their men. So I think that no matter who's listening to this, I think it will serve you and your partner as well. So you could just spread this like wildfire, because I think it could serve anybody today. So, excuse me, as I mentioned, you cover topics that are rarely talked about and people feel very shameful about. So I would love to hear, what is your expertise first before we get into this, and why are these topics so, if you want to say taboo, or something that people don't even want to talk about and they feel shameful about?
Yeah, so my expertise is I'm a board certified urologist, and a urologist is essentially a medical and surgical doctor of the genitourinary tract, so the kidneys, the bladder, the genitals, and then I subspecialize in both urogynecology, pelvic medicine and reconstruction, as well as sexual medicine. And so I take care of things like women with urinary incontinence, pelvic organ prolapse, and men with bladder issues and prostate issues. And then I also take care of sexual dysfunction in both men and women. And that can include, things like low libido, low testosterone for men, erectile dysfunction, difficulty with arousal for women, and a whole host of different things that essentially, spread the gamut. And a lot of things that all sort of come together with, as you mentioned, the pelvic floor, which is, all the organs that sit on top of the pelvic floor, the bladder, the rectum, the uterus, the vagina, the urethra, all that stuff comes together. And there's a lot that, we sort of do, but essentially, I think people tend to be sort of challenged about talking about this stuff because it's intimate, right? It's like your genitals. And when you were growing up, your mom probably said, oh, she may not even given you the words for it, right? I mean, hoo-ha or coochie or your kitty or whatever, right? But it wasn't like your vulva and your vagina. And so we don't know the parts necessarily. We don't know how to describe what's going on necessarily. And sometimes we just feel like we're broken and something's wrong with us. And because we don't talk about it. So we don't know what's normal and what's not normal.
Yeah, so true. That's so interesting. And that's so true, is like, even talking about sex, like that is a topic that's now coming to surface. Maybe a few years ago, maybe 5 years ago, I remember when I had certain guests on the podcast that talked about sex very openly and like pleasure. And it was just coming to surface that those conversations were being had. It was never talked about back in our days, in high school or, following high school. So it's so necessary. And that's what I love about everything you're doing today. Not only are you still in practice, you're putting this out there, you are educating online, and you're wildly popular. So I just so appreciate that you're putting the energy into that, because that's what people need. So
Thank you.
thank
Thank
you
you
for
so
that.
much. Well, I appreciate
Yeah.
everything you're doing too with this podcast and reaching the masses. So, really great.
Thank you. Okay, let's start with the pelvic floor. So, why is it so important to address our pelvic health, and what's the roles that it plays?
Yeah, so the pelvic floor is essentially a bowl of muscles that connects to the bones, sort of from the pubic bone all the way to the backbone and to the hip bones. And so when there's issues in the pelvic floor, it affects a lot of different things because we use it every single day. We use it for stability. We use it for women when you're pregnant. We use it when you orgasm. We use it when you pee, when you defecate. It's relaxing to allow those things to happen. So when there's dysfunction in the pelvic floor, meaning it's not working normally, it can lead to a variety of different symptoms. Now, when it's really tense and not relaxing, that can lead to things like having urgency, gotta go, having urinary frequency, going often, or waking up at night a lot. It can lead to pain with sex. It can lead to pain with erection or ejaculation in men. It can lead to constipation. It can lead to even sort of hip pain or back pain, lower back pain. And so when it's too tight, when it's too loose or lax or weak, you're going to have issues with maybe urinary incontinence. So you might leak a little bit. You might notice that you're feeling like something's falling down in the vagina or prolapse of the organs in the vaginal canal. And so that is, those issues start from somewhere, right? And so when we don't pay attention to them early on, they just progress, right? If you have weak muscles and you don't work to strengthen them, then they will continue to progressively get worse. And the same thing goes for if you have a tight pelvic floor. It's going to be much harder to learn how to relax it if it's been going on for years rather than sort of addressing the issues early on. And oftentimes, because of all this embarrassment around these things, we find ourselves just pushing it off, pushing it off, pushing it off. When if we had intervened earlier, it would have been a non-issue. We would have been fine. We would have done some exercises or, done some little behavioral changes and things would have been fine.
And that's why we're here. We're going to address it head on and provide as much information about it as possible. So I know a lot of women have heard of the pelvic floor because, of course, as you mentioned, like giving birth or even doing Pilates or, certain workouts, like many women know about it, but it also addresses, or men also have the pelvic floor. And so you mentioned just addressing a couple of the issues you mentioned. So there's pelvic weakness. So what causes that? And what should we do to address that specifically head on?
Yeah, so weakness is very common in women who've had babies because they've carried pregnancies, even if they've had C-sections, but definitely vaginal delivery. It's often also in patients who do very high intensity exercise. They're increasing the abdominal pressure a lot. Sometimes they're overweight. Sometimes they have a chronic cough. Anything that sort of increases pressure in the abdomen is going to put pressure on the pelvic floor. A lot of people who stand all the time for their job, like nurses, hairdressers, tend to have, more pelvic floor issues than other people. So, and then obviously there's genetic issues. So some neurologic conditions can cause weakness of the pelvic floor, but it is very common for people to get a weak pelvic floor. That's why you hear people saying, oh yeah, I can't get on the trampoline because I might leak a little bit. And, that's a weak pelvic floor. When you cough, sneeze, lift heavy things, and you leak a little bit, that's usually because of a weak pelvic floor.
Okay, so how does somebody address that head on? What are some exercises or certain things? This makes me think of it because I recently saw this, the belly band. Would that help support your pelvic floor by lifting up the belly when you're pregnant?
Might. It's sort of the goal is to try to sort of alleviate the pressure a little bit. So certainly it might help. I don't think if you don't have it, you're like at a loss. But I would say that, you might notice that after pregnancy, for example, that you have some weakness right after pregnancy. Like you might notice, oh, I'm leaking a lot or I'm having these issues. Usually that gets better after 3 months. And so if you're starting to notice some issues, you can start doing pelvic floor exercises, specifically strengthening exercises. So the most popular one is the Kegel, which is essentially pulling up and in the vagina. So it's like feeling like when you're urinating and you stop the stream, that's essentially using those muscles to stop the stream. So you learn what those muscles are, and then you squeeze them and then you relax them. And the relaxation part is so important. So I tell people to start doing them lying down so that when you are lying down, you're not using any other muscles. You're focused on your pelvic floor. Don't clench your belly. Don't clench your butt. Try to squeeze up and in like you're trying to like suck up a little blueberry in the vagina, or squeeze up and in, or feel like you're stopping urine flow. Hold that for 5 seconds and relax for 5 seconds. And do that for sets of 10 to 15 to start, and do maybe 10 or 15 at night, 10 or 15 in the morning, and slowly work your way up, just like any other exercise, right? You do at the gym. You don't just do 100 push-ups on one day, because then you're going to overwork that muscle and be exhausted. You got to sort of work your strength up over time. And so those are exercises you can do. Also, things like yoga and Pilates often does a lot of core strengthening. So the core is not just your abs, right? It includes your back. It also includes your pelvic floor. So exercise that strengthen the core can be very helpful. And then obviously, if you're doing those exercises, to make sure you're breathing correctly. So you want to exhale on exertion, so that when you exhale, you're actually strengthening the pelvic floor. So it's holding things up for you, and it's helping provide that stability when you do an activity with sort of a heavy load.
I love that you mentioned the breath part, because I think that's where a lot of people don't really pay attention to when they're working out strength training or doing Pilates. They always talk about the breath with the movement, and not knowing that had actually to benefit of your pelvic floor with those exercises. So that's so good to know. And so how does this happen usually in men? Like you mentioned standing for a long period of time, but what would be other reasons this would happen for men?
So men, traditionally, if this also stands for women, is like long-standing constipation. So if you're constantly straining, a lot of bodybuilders or people who do, and they don't use proper breathing techniques. I mean, most people who are really in that sort of field professionally know to breathe and do those things. But some people, when they're just lifting very heavy all the time and sort of breath holding a lot, they can put like a lot of pressure on their pelvic floor. And so it doesn't present in terms of the same way it would with women. They don't always get leakage because they have a prostate and they have two sphincters compared to women who have one. And so they won't have leakage, but sometimes, rarely, they'll get what's called rectal prolapse. So their rectum will actually prolapse out of the anus. And that's rare, but it does happen. And then also they might notice some weakness in terms of like their ejaculate. So when they ejaculate, it might not be as strong of a stream. It might be a little weaker, because when you ejaculate, those muscles contract. And so when they're weaker, they just can't contract as strongly. So those are some of the symptoms they might notice. But generally speaking, I see in men a lot more symptoms from the other side of it when men have really high-toned pelvic floor.
Okay, so addressing the other aspect is the tightness. What are some ways that we could release the tension and the tightness in our pelvic floor? And again, what causes that?
Yeah. So let's take it one step back. One is like, what might you expect, right? And so some of the symptoms you might expect, we talked about urgency, frequency, any sort of pain in the pelvic area, you can expect that your pelvic floor is involved. It might be the causative factor, or it might be tense because it's responding to the pain. But if you have pain, if you have constipation, if you have urgency, frequency, or pain, any of those issues, I would say don't do those strengthening exercises, because they could actually worsen those symptoms. So until you see somebody who can evaluate your pelvic floor, whether it's a urologist, a pelvic floor physical therapist, a gynecologist, and of course, in these medical specialties, they should have some basic understanding of the pelvic floor, because not everyone does a pelvic floor exam. And so when you do that, then you can say, okay, I can do these exercises or not based on the tension in my pelvic floor. So if you have a tight pelvic floor, I describe it as TMJ, right? Like people get a tight jaw when they're sleeping at night and they wake up with headaches, right? And they don't really know they're doing it. It's just tense, and they're just starting to wake up with headaches. And so it's really your body's reaction to stress or trauma, or sometimes after women have babies, they'll notice their pelvic floor is a bit tight. And so if you're having that situation, a lot of times, doing, again, that diaphragmatic breathing can be helpful. Doing certain exercises that stretch the pelvic floor. So some I tell my patients to do are happy baby pose, child's pose, and all while doing diaphragmatic breathing, deep, low squats or figure four stretch. Those ones can really help lengthen the pelvic floor. But ultimately, if you catch it early, you might be able to just get away with doing a few of those exercises every day and kind of focusing on relaxing the pelvic floor. But oftentimes it does require some sort of dedicated time with the pelvic floor physical therapist, because just like I said, people don't know they're clenching their jaw. They also don't always know or can feel their pelvic floor, because we don't really think about it all that much. It's just always working in the background.
Right, exactly. As I mentioned offline before I press record, when I was prepping for this interview, as I'm listening to your content, I'm like, oh my gosh, this is ironic because literally, I think a couple months ago, maybe 3 months ago, I started needing to go to the bathroom in the middle of the night, like pretty much on a regular. And I noticed, of course, I drank tea maybe around 7:30, and then I would go to bed at 9. So that's pretty close to drinking before bedtime. So I started reducing that because I knew that was an obvious one, even if I went to the bathroom right before I went to bed. And so it's obviously very disruptive. And I know this is a common thing that people experience. So what is the core reason why somebody is waking up at the middle of the night to go to the restroom?
Yeah, so there's so many reasons, but I have one thing that might make everyone a little bit sad is that after about 55, you're going to wake up once. Most people will wake up one time. And the reason for that is because after around 55 or so, there's physiologic changes in your body that make your body make more urine at nighttime. So the signals from your heart that send to your brain that makes your kidneys work a certain way will make you emit more of your urine output at night. So about 2/3 or about a third of your urine output will happen at night. So your bladder just typically can't hold that much. And so your bladder holds on average somewhere between 10 and 20 ounces, usually 16 or so. And so, if you're making, let's say 80 ounces of fluid a day, and you're doing a third of that at night, it's going to be really hard for you to hold that much urine. So you're just going to have to urinate once a night. Now, you're clearly not above 55. So no. So you should be able to sleep through the night. So why do people wake up at night? Well, let's start with women. So very often, we say waking up at night, we think about things like overactive bladder. So overactive bladder is when your bladder has it feels like it's full before it truly is full. And it gives you a sensation or an urge to urinate that you can't delay, right? Like sometimes people would say, yeah, I wake up, I feel like I might pee, but I might fall back asleep and it's okay. That they can delay that urge, but some people can't delay it. Like, I got to get up, I got to pee. Now, it can be for a variety of different reasons. Sometimes it's due to things like sleep apnea. So if you are a heavy snorer or your partner says, hey, you're waking up at night like gasping for air, it might mean that you have sleep apnea. That's very often correlated with waking up at night. That's one. Two is if you have diabetes. So diabetes actually affects bladder function over time. And so that will make you wake up more often. Other neurologic conditions similarly can do that. If you've had pelvic surgery, sometimes things like slings, which are used for stress incontinence, those or anything that is used for stress incontinence that sort of makes the urethra a little bit sort of more supported. Sometimes if that support is too tight, your bladder responds by becoming overactive. Or if you've had anything that would affect the urethra and make it more tight, it could, if you've had like a procedure or something like that, that sometimes is the cause. And sometimes we just don't have a cause, right? And it's because of idiopathic overactive bladder. But there are things that you can do to help prevent that. So let me sort of go over the things that make that worse. So one is drinking a lot, right? So a lot of times what people do is they work all day, they forget to drink because they're just so busy. They're talking, they're doing this, they're doing that. And they drink a ton of their fluid in the evening. They do stop a couple hours before bed, but they're drinking a lot in the evening just to catch up from all the fluid they didn't take in. So that's one. Two is they're just drinking a lot, right? Everyone says drink a gallon of water a day to lose weight. You're going to urinate frequently if you drink a lot. The goal is to make your urine like lemonade yellow, little light yellow. It shouldn't be dark yellow. It shouldn't be clear like water all the time. It's okay once in a while. And so that's kind of how your body tells you that you're making the right amount of urine, you're drinking enough. Two is bladder irritants. So a lot of people don't really understand, like, I've been drinking this way or eating this way my whole life, and now why all of a sudden am I going to the bathroom so much more? So you mentioned one, you maybe just took a sip of it, tea or caffeine. Caffeine can irritate the bladder. Now, I joke with my patients, like, you'll take my coffee from my dead hands, like, I won't give it up. But I tell people, like, you can minimize it, right? You can do half calf, you can do decaf, you can, instead of 2 cups, drink 1 cup. Just try to sort of see if it makes a difference for you. For some people, it doesn't, but for a lot of people, caffeine is a huge bladder irritant. Another one is alcohol. So particularly in the evening, people tend to have a glass of wine with dinner. That can start affecting your bladder and making you feel the urge to go more often. Other things are sort of some people do and some people don't, but citrusy fruits and juices tomato-based products, artificial sweeteners, and even sometimes carbonated beverages. So for some people who are drinking like 10 seltzers a day, like they might notice that they're going a little more often and at night. So those are some things that, and I've told you don't have to give it up for weeks. You can just give it up for a day or two and see if it makes a difference. And so it's really simple. Try one thing, eliminate it for a couple of days, see if it makes a difference. You will know pretty quickly. And if it doesn't, put it back in your diet. And then the next thing is constipation. So if you are constipated, if you think about the anatomy, the rectum is right behind the bladder. And so if it gets full with stool, it's pushing on the bladder, which makes it more overactive. And a lot of people don't realize that. So treating that constipation, whether it's with foods like prunes or increasing your fiber intake or taking fiber supplements, or then adding medications like magnesium citrate or magnesium oxide, and Miralax, those things can help treat the constipation. But you will also notice when your bowels are regular, your bladder is better too. And then lastly, weight loss. So if you are overweight, it's actually been shown that if you reduce weight, that you can reduce your urinary symptoms pretty significantly for both leakage with urine. So if you cough, sneeze, lift heavy things, or with that urgency, frequency, waking up at night. So those are sort of the things that can all play a role. And then, it's it's a lot of different things, but ultimately trying to figure out what's going to work for you. And like I said, it changes over a lifetime.
So listening to all those things, I pretty much could eliminate all those. The only thing, and even, I stopped doing the tea at night because I realized that was a for sure, can't do that. But I am being more mindful of how much liquid I have in the evening. And I go to the restroom before bed. I'm not 55. And it's still happening. So it's just interesting. You list all the things. I'm like, okay, not that, not that. So what else could be possibly something to address? Like, is there other things going on that I should look further into? And I'm talking, I'm sharing my situation vulnerably. Obviously, this could be for anybody listening too. I'm sure there's somebody out there that feels the same way.
Sure. Yeah. No. And I think, ultimately, like what else could be going on? I think one is, are you waking up? Are you waking up with the urge? And I'm assuming you are, like the urge to pee. But some people wake up because they're already awake and then they pee. And then you got to fix your sleep. So I just want to touch on that for some people because there are a select number of people where that applies. Now, in terms of other things, so like I mentioned, the pelvic floor, when it's tense, usually it gets a little bit better at night. But for some people, when they have high tone pelvic floor, they're still waking up all night. And because their pelvic floor is still tense even when they're sleeping. So that's one. And then, like I said, there's some cases that we just don't know why. And so in those cases, we work through those conservative options. And then there are, medications and procedures available that might be able to help.
And in that case, would you recommend go see a professional to possibly look into things further to see potentially what could be going on?
Yeah, absolutely. I mean, I think a lot of people can really take back their life with a simple daily medication. The issue is that it is sort of a chronic condition. So if you have overactive bladder, and we don't find a root cause of it, then it's considered a chronic condition. And so I would say anyone who's dealing with, obviously see your doctor because you want to rule out urinary tract infections. You want to rule out like diabetes, you want to rule other things that might be causing those symptoms, of course. So even seeing your primary care doctor is important. But ultimately, once if we've ruled everything out, then it becomes something that we treat chronically. So that's something to think about. There are procedures available. Some of them are very minimally invasive, like there's acupuncture type procedures. There's bladder Botox, which is still pretty minimally invasive, and bladder pacemakers, and a whole bunch of sort of neuromodulation procedures that we have that sort of try to restore normal nerve function to the bladder. So there are lots of things available, and I encourage you, if you're really struggling, to talk to your doctor. But if you are not bothered by any of these things, like say you pee a lot, but you're like, yeah, I love drinking my water and I'm okay with it, that's okay. It's a quality of life thing. Now, we want to make sure sometimes what we find is that people aren't emptying their bladder well, and that's what's causing them to wake up at night. So that's where the evaluation comes in, is if we find that, hey, you're not emptying completely. And I see this a lot actually in women who have like for many, many years held their urine. So like nurses, hairdressers, surgeons, they don't go to the bathroom for hours at a time for years. And then over time, the bladder muscle gets weaker, and then they as they age, their bladder just doesn't completely squeeze as well as it used to. So the bladder doesn't empty as well. So we'll tell people in that case that, try to go to the bathroom, sit, relax, lean forward, pee, then stand up, walk around, sit back down, pee again, and try to, really empty the bladder, try to relax. And then, we can try some things to help you learn how to empty better, or even some medications potentially off-label to help you empty your bladder a little bit better. But, those are some things that oftentimes when I do find it, particularly in women, they don't even know. They'll be like, oh, I didn't know I wasn't emptying, because they just got so used to it in that particular circumstance.
Right. Thank you so much. So, of course, we're talking about the bladder, so we have to talk about UTIs, because this is actually so common, right? I mean, so what is causing UTIs, and how could we avoid it, most importantly?
So before I get into what's causing it, I want to say what's not causing it. It's not because you're dirty. 100%, it's not because you're dirty. I don't know which doctor has been telling you to wipe from front to back or back to front, or, you're doing it wrong. No, it's not because you're dirty. Like, unless you are literally taking soiled like feces and rubbing it on your urethra, like, you're not dirty. And I think most women know that, right? So I think there's a lot of shame with people who get UTIs. People feel really bad, like they're doing something wrong. Maybe their partner is giving them UTIs if it's happening after sex. And sometimes it's not always an identifiable cause. Some people are just at higher risk, right? You can be at higher risk because, there's obviously reasons. If you're immunosuppressed, or if you're not emptying your bladder well, those are things that will cause you to get UTIs more frequently. If you have kidney stones, those are things that we would evaluate for, right? We make sure that those are not there and problematic, or other sort of anatomic abnormalities. But the large majority of people, we don't find out why. So it's about prevention. How do we prevent UTIs? So number one thing is hydration, which seems really boring and sort of counterintuitive to what I talked about, but for overactive bladder. But when you drink 1.5 liters more than you're currently drinking, you reduce your risk of UTIs by 46%. So it is very remarkable how much hydration plays a role. I mean, you're just flushing out bacteria, and there's always bacteria in the urinary tract. So it's not sterile, unlike what people think. There is always bacteria in there. And so, you're just flushing out as much as you can, and it works. And 40% of the time, our bodies will clear out our own bladder infection. So you might feel like a little bit of twinge, like you might be getting UTI, and it goes away. And that's because your body just took care of it. So that's one. Two is, again, constipation plays a role here. Women who are constipated tend to be more likely to get UTI, so treating the constipation often helps. People who hold their urine a long period of time, even if they're emptying well, if they're holding, like, I've had patients come in, I only pee twice a day, and I'm like, twice a day? Like, you're holding that much urine all day long, that's food for bacteria, right? So sometimes I'll tell people, urinate on a schedule. Now, the most common reason that I see women getting UTIs is around the perimenopausal to postmenopausal stage. And that's because they're losing estrogen. And estrogen is very important in the microbiome of the vagina, and it actually keeps the pH acidic. So when the pH is acidic, it prevents bacteria from sort of getting in there and colonizing. But when you lose estrogen, the pH becomes more basic. So it gets higher, which allows more bacteria to then get into the urethra. Your urethra also gets shorter because of the changes to the tissues with lack of estrogen. And so again, all these things together are putting you at higher risk for UTIs. And so there's a really great treatment, vaginal estrogen, which is a vaginal hormone cream that is, or cream, ring, or suppository, very easy to apply, very safe, doesn't have the risks of systemic hormone replacement therapy. So like the patch or the gel or the pills, very different in terms of side effect profile. There's no risk of breast cancer, uterine cancer, stroke, heart, and none of that. It's all very, very safe. And so, generally speaking, I think that everyone should be on it if they're having any sort of UTIs, any symptoms. It's basically like skincare for your vulva is the way I think about it, in your vagina. So I think it's very helpful for that. Now, if you're having them after sex, then that's sometimes, it's not the person, it's usually the thrusting motion of sex that puts you a little bit at higher risk. And so in those cases, you can talk to your doctor about maybe taking one pill of an antibiotic after sex to prevent the UTI from coming on, or you can try cranberry supplements. Now, cranberry supplements are actually in the AUA, American Urological Association guidelines for UTI prevention. And that's because there's been a number of studies that have shown that cranberry supplements with 36 milligrams of proanthocyanidins, or the highly concentrated cranberry juice daily, can help prevent UTIs. Now, we can extrapolate that, and some people will say take 2 cranberry pills on the day of sex and 2 on the day after, and that might help. But even if you're suffering from UTIs and you don't know why, then taking cranberry supplements may help you. So those are sort of the big things that we talk about. But again, it's really important to make sure there's no other underlying cause. So I will sometimes get referred patients and I'll find things that they didn't know they had, like a kidney stone or an anatomic abnormality that's causing their UTI, or that they're not emptying their bladder. And that then has to be addressed.
Great. And so you mentioned the vaginal estrogen cream, and I'd love to just pull that out real quick because you said there's so many benefits, and I've heard it talked about, and it's actually talked about a lot right now. It's having a moment. And so what are some other benefits? And I know that also I heard that it doesn't up your estrogen. It doesn't work that way as taking it internally as HRT. So what are some other benefits? And is it something you recommend to maybe women in perimenopause and above?
Yeah, so let me tell you the benefits first. So basically what happens during perimenopause and menopause, and the issue is that when you start losing estrogen in your whole body, we talk about hot flashes, they last maybe up to 10 years in the worst case scenario. But in terms of the genitourinary syndrome of menopause, the symptoms I'm going to talk about, these last starting from any time between perimenopause until well after menopause. So you could start having these symptoms in your 70s. And so this is why I think it's so valuable to discuss. So what happens, right? One is that the tissues become thinner and more friable. And so that means that you could have more discomfort with sex. You'll have less lubrication. You might even bleed with sex. So that makes sex less fun, right? And less enjoyable. And then you start avoiding sex, and it creates problems in your relationship potentially if that's what your partner wants. And you obviously don't get the benefits of having sex with your partner. Like I said, the risk of UTI goes way up. And actually, they just published great data at the American Urological Association showing that women on vaginal estrogen had a significantly lower risk of hospitalization and sepsis and UTIs compared to women who were not on it. So I think ultimately it is so huge for preventing UTIs. Know this, though, when you start it for a recurrent UTI, so say you've had UTIs, you finally get vaginal estrogen, it doesn't work right away. It takes about 3 months before the tissues actually get all the estrogen in them so that it can be that nice pH and that good microbiome to help prevent UTIs. So that's one benefit. The other one is dryness. And then, we will often say that you can also put it on the vestibule, which is the space between the vagina and the outside, the inner lips, because that area is also very hormone sensitive, and even on the clitoral hood and the labia minora, because those tend to be also estrogen responsive. So you might notice if you look in a mirror and you look down the vulva that those tissues are actually getting smaller. They're resorbing, and they're even sort of getting sort of combined or stuck to the bigger lips with labia majora. And so using vaginal estrogen will keep that tissue all youthful, healthy, soft, supple, all those things. So I think ultimately, in terms of does it increase your estrogen? So sometimes, rarely, when you first start it, you might see an increase in your total body estrogen. Now, that's because they tell people to take it every day for 2 weeks. I don't do that with my patients. I say twice a week from now till death do you part. Do it twice a week, and you'll never forget it. You just put in your phone to remind yourself, or whatever reminder system you want to do. But you don't really need to do that once a day for 2 weeks. There's actually no scientific evidence that proves that it's needed. And so then that reduces that risk of having a little bit more estrogen on board in the body. And so sometimes women, when they have that, will notice like they get some breast tenderness or some discomfort. And so that avoids that. But then ultimately, when you look at the data on how much gets absorbed, it is so low. It's basically you're still in postmenopausal levels of estrogen. It didn't even bump it up to premenopausal levels. Like estrogen barely goes up. It's so small. And so, yeah, it barely goes into your, it's really just for those local tissues. The last thing I'll add is that even if you're on systemic estrogen, like you're taking a patch, or you're using a gel, or you're taking a pill, you still can benefit from vaginal estrogen because it's not helping those tissues necessarily. You need actually topical estrogen on the tissues to actually help those tissues get those benefits.
Awesome. Thank you so much for sharing that. Okay, so let's move to men a little bit because this is, I know, a big topic that a lot of people come to you about. And so one of the things that men experience, especially as they get older, is ED, erectile dysfunction. So why is this happening and what's the root generally to this?
So erectile dysfunction is very common. It's about 52% of men over 50 will have ED, and it increases every decade by about 10%. So it's very common. Now, why does it happen? Well, we think about 5 causes of erectile dysfunction. Most common in that age group above 50 is vascular dysfunction, so meaning blood flow. So think about all the things that affect blood flow: high blood pressure, diabetes, high cholesterol. All those things can affect blood flow. But even if you have none of those, your erectile dysfunction can be a sign that you might have a problem brewing, or we call it canary in a coal mine. Because when you have, if you think about the vessels to the penis, they're 1 to 2 millimeters. When you look at the vessels to the heart, they're 3 to 4 millimeters. So they're going to get blocked off or have issues long before your heart does. And so when a guy comes with erectile dysfunction, or if your partner has erectile dysfunction, I strongly encourage that you see your primary care doctor to get evaluated, because sometimes you will find that there's, occult coronary artery disease. And so that is something that we can catch and potentially prevent a heart attack, because we know that 15% of these guys who have ED will have a heart attack within 7 years. So that is really a point that you need to really look at and say, hey, this is not just a sexual problem. This is a whole body, potentially a sign that something else could be wrong. Now, other causes can be hormonal. So sometimes if you have low testosterone, that can contribute to having poor erections. It can be neurologic. So if you've had surgery or something that affects the nerves to the penis, that can cause an issue. It can be due to psychogenic issues, which is very common. I think everyone who has ED has some psychogenic component, meaning that they're stressed about it. And it's affecting their confidence in bed. It's affecting their ability to get an erection, because every time they're about to have sex, like, oh my God, am I going to have an erection? Is it going to come? And if it doesn't come, then they're more stressed, and it just keeps getting worse and worse. And so no matter what the causes, every guy is struggling in their head about erections if they've suffered with erectile dysfunction. And then lastly, medications. So things like antidepressants, certain blood pressure medications can affect erectile function. And so it's important to sort of evaluate with your doctor what medications could be causing that, and see if there's alternatives that you could potentially use.
Do you find that a lot of men actually address this issue, or do they ignore it? Like, I mean, obviously you have a practice, people come to you, but just on average that
It's a huge market. I think there's a lot of men who struggle in silence. One is men never talk about this with each other, right? They don't like call up their friend like, hey, man, what are you doing? Right? They don't do that. And so one, they struggle in silence. Two, I think it's a little bit better now because we do have sort of telemedicine. We do have options available for patients. So they can get access to doctors a little bit easier than they did in the past. But I think the real issue is that men aren't getting the conversation about why this is happening, right? And so they're just looking for Band-Aids to fix the problem, and they're never really addressing the root cause. If I told a guy, hey, you can do 150 minutes of aerobic exercise a week, and that's as good as taking sildenafil, and that's going to actually reverse the erectile dysfunction, then I think most guys would choose to do that, right? And so, but they're not getting that education, which is one of the reasons I make the content I do, because I think there's so much there that we need to educate people on.
Oh, so good. So necessary. That's amazing. And I know you have tons of videos on that topic in itself. And you talked about something so important, which is the blood flow. And we know that if your blood is stagnant, it causes a host of problems. So we need to have blood flow for everything to work properly. So how does one even know if they're lacking in blood flow in that area? Would it just be the symptom of ED, or like what would be other reasons?
Yeah, so typically when you have erectile dysfunction, it is there's no way to specifically differentiate between, is it a blood flow issue, is it a hormonal issue, is it a medication issue? I mean, you can rule out, like, if you've never had surgery before, it's probably not neurologic, if if you're not on any medications, it's probably not due to that. But like I said, it's hard to differentiate specifically what the cause is. But like I said, the majority of guys who are having ED, and it's consistent, and it's usually due to blood flow issues. Now, with younger guys, sometimes it's on and off, and that maybe there's more of a psychogenic component. I think, unfortunately, also with the availability of pornography, people are seeing like a lot of sex that's not similar to what really happens in real life, which leads to a lot of insecurity and self-esteem issues that then causes the inability to get an erection because you're stressed. So the more psychogenic ED. And we're definitely seeing more of that in younger guys, but they can still have blood flow issues. So ultimately, how do you figure it out for sure? You can get a Doppler, a blood test called a penile Doppler, which is an ultrasound, where they'll give you an artificial erection. So they'll give you a medication, they'll inject a medication into the penis to make you have an erection, and then see if there's specific changes in the blood inflow and outflow on the penis. But generally speaking, I mean, like I said, the majority of guys have arterial or have, vascular causes. And so usually we just start by treating those causes and see if you improve. If you are really having no improvement, then I'm more worried that we're missing something else.
Yeah, so good. And then I know one of the key things I've heard you mention is it's actually a good sign if you're having erections throughout the night, and you should be.
Yeah, absolutely. So both men and women have 3 to 5 erections at night. So men have erections, obviously, of the penis. Women get clitoral tumescence, so their clitoris gets engorged. Now, they won't necessarily know it, but I think every woman can remember a time where she woke up feeling a little bit of that pelvic pressure, blood flow sort of in the genital region. And that's basically clitoral tumescence, right? It's not that you were dreaming something erotic necessarily. And same thing goes for guys. It's just your body's physiologic way of sending good, healthy blood flow to the genitals and keeping that tissue healthy. So even if you're not having sex regularly or you're not masturbating, you're still having good, healthy blood flow to the genitals. So it's a good sign that everything's working, right? Your blood flow is getting there. Your hormones are functioning correctly to get that blood flow there to get you the erection. So it's a great sign. So sometimes, I don't know if maybe your audience has seen that episode of like Sex and the City where she puts like the stamps on his penis, like as a ring to see if he's getting erections at night and if it breaks. So, like there are.
Gosh, I haven't seen that. That's great.
But like there's a test that we can do called checking nocturnal penile tumescence. Now, you don't need to do that, but if you are really concerned, sometimes it's a test that you can say, hey, you are getting nighttime erections, so things are working okay. Maybe we have to do some more investigation on the psychological side of things. And that is challenging for people to accept, right? Because like something's wrong with me, it's not in my head. And I think that it's really important to realize like everyone who's dealing with any issues in their sex life has some component of stress about it, right? Everyone, women, man, anyone, they're stressed about it, and that's going to affect you whether you think it's affecting you or not. And so I think that sex therapy is so important. If you can find a good sex therapist to help you talk through some of these things and figure out sort of how to control your thoughts around it, can be really transformative.
Yeah, I think it's so important that you mentioned that, the psychological aspect of it. So I feel it's important I pull out one of your most popular videos or subjects, I guess you could say, and that is penile length. And I know this is, and it's interesting to me that this is such a wildly popular topic that you have on your YouTube channel, for example. And that just tells me that society today is making men think that they're not adequate enough, that they need to be bigger, that their girth needs to be bigger, And so I'm just curious, what have you seen around this topic? Like, why is this so wildly popular for men to want to have a bigger, longer, stronger penis?
I mean, one, I think about society, right? We're always glorifying larger, bigger is better. Like you tell someone that someone has a big penis, like say you're talking with your girlfriends and someone's like, oh my God, he was too big. And everyone's like, whoa, it is just so glorified. And so that's one. Two, it's also like lack of understanding about general anatomy, right? Like having a larger penis doesn't necessarily mean it's going to be more pleasurable because for women, orgasms and pleasure 85% of the time come from stimulation of the clitoris, right? And so the clitoris can be stimulated without penetration, can be stimulated with a finger, a toy, and doesn't need a penis to reach an orgasm. And so and the length certainly is not always leading to orgasm. Now, don't get me wrong, there's a subset of women who get significant pleasure from cervical stimulation, and they do get sort of orgasms related to cervical stimulation. And so larger penises do tend to be more enjoyable for them. But the large majority of women don't. And so I think that's part of it, is like, we've never talked about how women orgasm. We've never been taught that. We've never taught our kids that. And so they're just like, well, I think if I have a bigger penis, I'm going to have a better orgasm, because I'm certainly not getting it through vaginal penetration alone. And like, when I watch movies, all I see is like, this woman gets penetrated and she's orgasming with her partner within minutes, which is, again, not reflective of normal. But it's a real issue. Like, not when you think about what men want in life, you would think, okay, most guys probably want to be taller. So I think the statistic is like 45% of guys want to be taller, but even more than that want a large, like, I forget, it's like 60 to 80% want a larger penis, and that's larger and girthier. And so, not everybody would do something to get a larger penis, but there are a lot of men who have what we call small penis anxiety. And they feel, even though they may be normal, average size, they feel very concerned about the size of their penis. They become preoccupied with it. And it's really actually sort of sad, but they could benefit from sort of psychological therapy. But then, ultimately, just like women want larger breasts, some men just want a larger penis. And unfortunately, we don't have anything yet that's as sort of straightforward as doing breast implants. So in terms of length right now, there are some surgical techniques that have been developed. I would say there's not a lot of surgeons doing them. So there's lots of high complication rates. Ultimately, I tell people, if you're going to do something, to try a traction device. Those are shown to increase penile length with, continued use over months and hours a day. And then you can see some about 2 centimeter increase in length potentially. For girth, we have now more and more people are doing hyaluronic acid fillers, just like the same cosmetic fillers that women get in their face. And so that's been pretty safe relatively. And the only downside is it's temporary, right? It's not going to last forever. And so, but for some people that's enough. And there are some urologists offering that. So like I'd say, when anyone's thinking about doing something to their penis, they only have one penis. So I always caution people, do the least risky thing that can get you the result that you want, and really think about why do you want that result? Like, oftentimes they've never even talked to their partner about how satisfied they are. And actually, when you look at, majority of women are satisfied with their partner's penis size, and they're not really upset about it. So I think it's really something that is just societally has created this sort of desire for length and girth.
Oh, wow. So that's so interesting. But like you said, it's like there's solutions out there, but step by step, don't go drastic and do something to your penis just to make it bigger.
Yep.
But I would love to just move to sexual health. That's another thing you talk about a lot. And I think this goes to women and men. So I'm just curious, with ejaculation and then women coming, is it harmful to do too little or too much? Like, is there a sweet spot? Like, you should be at least having a practice, whether it be with a partner or without.
Well, so there's no great evidence in terms of like what you should absolutely, there's no like mandatory, right? But in terms of evidence for sex, so let's just say they have looked at like the frequency of sex and in terms of longevity and in terms of mood. And they found that people having sex more than once a week or more, were likely to have, more longevity than people who didn't have sex once a week or more. Now, they do try to control for a lot of things, but you can imagine that someone who's having sex once a week or more has more connection with human beings. It's probably healthier. And of course, they try to, control these things for overall health. But like, they're probably healthier. They probably have more connections with a partner. They're probably having intimacy with that partner. And so they're getting the benefits of like having another person that they're intimate with, as well as the actual sexual benefits. But when you think about orgasm, there's lots of benefits to orgasm, right? We know that you can decrease stress. You can decrease your heart rate, your blood pressure. You can for some people, helps them focus. For some people, it helps them sleep. And so getting regular orgasms can be very beneficial. It can even help with pain, right? There's been studies that have looked at how orgasms improve pain. And so certainly getting orgasms can be beneficial by yourself or with a partner. Now, in terms of ejaculation, there's been studies that have looked at ejaculation frequency and prostate cancer. And so what they found in these studies, and these pretty well done studies, but they basically combined people into groups. Did they ejaculate 3 to 7 times a week, 7 to 14 times, 14 to 21, 21 and up? And what they found in the study, after controlling for all the sort of factors, that men who ejaculated 21 times or more a month were less likely to get prostate cancer compared to guys who ejaculated, I think it was like less than 7 times or maybe 4 times a month.
Wow.
And so what does that mean? I mean, the theory is that when you're ejaculating, whether it's by yourself or with a partner, you're getting sort of the fluids moving. There's no stagnant fluid in the prostate, which is, contributing to obviously the semen, the seminal outflow. So that's possibly the theory as to why that helps. I tell you, look, you don't want to look for a benchmark. I got to do it 21 times. If I didn't do it 21 times, I failed. I think it's, again, a factor of like, do you have a regular practice of, sort of all those benefits, right? I think there's so much benefit to being intimate with someone regularly. There's so much benefit to having pleasure and joy and fun. And like, especially in today's modern society, like taking time to be with your partner is so important. Or a partner. It doesn't have to be one partner.
Exactly. So I know I've heard you also talk about this, and this to me became a kind of surprising as well. Sexual health people talk about a lot of hormone health, and that's like the biggest factor. Like, make sure your testosterone's right, especially for men and even women. But actually, it's a smaller percentage that actually contributes to sexual health. So what are the other factors, and what is like the percent that actually is hormones?
Yeah. So when we talk about testosterone, specifically, let's talk about for men first. Testosterone is very important for libido. It's very important for a whole host of things. So it can help with mood. It can help with brain fog. It can help with muscle mass and reducing fat mass. And it also can help with erections. Now, it is oftentimes part of the picture, right? Testosterone, we know that people who have low testosterone are more likely to have metabolic diseases like diabetes. They're more likely to have, die prematurely. They're more likely to even have prostate cancer. And so testosterone is very important for sexual health overall and overall health. It's a great marker that can tell you a lot of different things about your overall health, your brain health, your bone health, just so many things, right? So testosterone is very important. Now, when it comes to erectile dysfunction, a lot of guys are like, oh, if I just get testosterone, my erections are going to get better. The percentage of guys who have ED, now this is defined as the inability to sustain an erection for penetrative intercourse. Those guys, when you look at the data, it's about 3 to 6% that are just from hormonal causes. It might help, but it's not going to be solely due to testosterone. We know that if someone's on medication like sildenafil or tadalafil, and it's not working so great, but they also have, low testosterone, we give them testosterone, now their erections are better. So it's sort of all working together. Now, in terms of women, testosterone has receptors, again, all over the body, including the vulva. And so testosterone has benefits, we think, very similarly. Now, what we know for sure is that it's sort of off-label use is indicated for low desire or hypoactive sexual desire disorder. That when we give women testosterone who are low and have symptoms of low libido, that it can improve their libido. But, there is some data, I guess, on depression and muscle mass, but it's not a ton of data. Now, I think part of the reason is like women are just not studied as much as men. And so that's part of the issue there. But I suspect that if we did all the same studies at the same rigor, we would find similar outcomes. But again, it's not there yet. I can't say with a certainty that, yes, if I give you testosterone, your muscle mass is going to improve, your mood's going to get better, all those things. I can't say that with any degree of certainty, but I suspect that's true.
So good. Okay. So if someone, man or woman, wants to improve their overall sexual health and make it optimal, what are like the first 3 things to address?
So first 3 things are unsexy things. So one is diet, right? So you want to have, a lot of sort of a varied diet with fruits and vegetables. There's lots of benefits from like polyphenols that we see in terms of overall health, and things that can boost sort of nitric oxide, which is like the key for the ignition for erection. So things like arugula and spinach and those sorts of things that can increase beets, can increase nitric oxide. So there's just basically you want to include a diverse amount of fruits and vegetables. The best studied diet is the Mediterranean diet. Now I tell people, look, like I can't tell you what's exactly right for you. We're not there in medicine yet for me to like look at your blood work and say, this is the right diet for you. But we just know that right now the Mediterranean diet is the best. I would say there's also evidence that, things like protein are valuable for muscle health, which is also important for a variety of longevity things. But also, if you think about just the basics of having sex, you need some baseline muscle health to be able to do certain positions and sustain them for long periods of time. And if you want to be more creative and lift your partner or do certain things, you need to be even stronger, right? So that's valuable. And then I would say in terms of, and then just avoiding, like everyone knows this, avoid highly processed foods as much as you can. Those are really the most calorie dense foods that are going to create the most excess in terms of calories and obesity and those sorts of things, which then also cause negative effects in terms of cholesterol, high blood pressure, and then cause issues with erectile function. And so that's one. The next thing is exercise. So we know, as I mentioned earlier, aerobic exercise, 150 minutes of aerobic exercise is as good as taking sildenafil for erectile function. We also know that doing resistance training of the big muscle groups, so that's like squats, deadlifts, those sorts of things, are going to be really beneficial for hormone health. So they're going to boost your testosterone. Now, it's not going to be testosterone. You do it once, your testosterone's high forever, but the continued doing of it over time is going to benefit your overall hormone health. So exercise, right? And even as simple as walking. So there's actually some data for prostate health that if you walk, 150 minutes a week, that you see benefits in terms of prostate size, prevention of prostate enlargement. So diet, exercise, and then I would add sleep. So sleep and stress reduction. Sleep and stress reduction. Sleep is always there because sleep is so important for testosterone, and that's when your body sort of replenishes and repletes all the testosterone that you've used throughout the day, right? And so you're in the morning, you wake up and your testosterone is high. That's why people are horny in the morning. That's why you feel the best in the morning, because you have the highest testosterone, you have the most energy to go do things. And so sleep is really important. If you're not getting enough sleep and not getting quality sleep, particularly in the second half of the night, so between, whatever that is for you, but let's say like between 2 a.m. and 8 a.m., whatever, that half of the night is going to be really important for getting the most boost in testosterone. So sleep is really important. And then, we don't talk about it enough, but stress reduction. Like stress is huge. And a little bit of stress here and there is fine, right? That's good for you. But if you are chronically stressed and you are not allowing yourself time to relax, or you're burnt out, it's going to affect your overall health. It's going to affect your sexual health. It's going to affect your hormonal health. And we know it's true. If you look at sort of people who are in military training, their testosterone's tanked because they're super stressed. These are guys at their peak physical fitness, right? But these guys, their testosterone is tanked because they are so overly stressed and worked so hard that it comes down. And so, most people are not going to get to that point in terms of physical exercise to cause their testosterone to go down low. But some people, chronic stress does create a toll.
Okay, there has been a wealth of information. Luckily, you talk fast, so we got so much in this episode, which I love. I love people that talk fast because we could just cram in so much in the episode. So thank you for that. But is there anything you feel we missed that you feel is essential to talk about today in this episode?
I think what I want people to take away from is like, look, if you are struggling, just don't struggle in silence. Like, just go talk to your doctor. If you don't like what your doctor says, find another doctor that helps you, because you know what? There are people who inadvertently don't know enough, right? And then they will just say like, oh, just have a glass of wine, or here's a pill. And, I don't have time to talk to you because I got my other patient waiting. And they're not poor intentioned. They just don't know. And they just, they want to help you, but they just don't have the skills or the education or the training or whatever. And don't take it personally. Like, there's lots of doctors, there's lots of people that can help you. And thank God for social media and podcasting and the internet. Like, you can find so much information and empower yourself. So what I want people to take away is learn about your bodies, take the time to educate yourself, find a doctor that you like, that you connect with, that can help you along the way.
Amazing. And of course, if this episode resonated with anything that was mentioned today, you really have to dive deep into everything you share on your YouTube channel and your podcast. So, Rena, can you mention where could people find out more? Where could they go? Of course, everything will be in the show notes, but just so you verbally tell them so they can find out more.
Sure. So check out my podcast. It's the Rena Malik MD podcast. So just type in my name. Same thing for YouTube. Type in Rena Malik MD. You'll find my channel. Everything is there. All my content, my shorts, my podcast episodes go up there too. So you can find a wealth of information. And if you're struggling, you can always just go to my website, www.renamalikmd.com, and everything I'm doing is there. And it's always updating and evolving as I do new things. But, I love helping people, and I hope that this helped you. And thank you guys for listening.
Oh my gosh, thank you so much. And you have a practice yourself, so people could make appointment and see you or someone in your team. Is that correct?
Absolutely. They just see me as I'm the only practitioner in my practice. So I see patients in California, in both Irvine, California, and Beverly Hills. And then I do telemedicine for patients in 7 different states. So New York, New Jersey, Maryland, Texas, Virginia, Florida, Illinois, and California.
Amazing. So get on the wait list because I'm sure she's very busy. Thank you so much for your time. This has truly been an honor, and there's been just so much information we gathered in this interview. So I just so appreciate you making your time.
No problem. Thanks, Erica.